Hi friends, welcome to the Good Story episode. Today we are going to see about India's out-of-pocket health expenditure. Households' out-of-pocket expenditure on healthcare has always been a major contributor to India's total health expenditure. So what we are spending away from our pocket towards healthcare is very high. So we are not having enough insurance covered. While the figure has improved over the years, from for 69.4% in 2004 to 2005 to 48.21% in 2018 to 2019, according to National Health Accounts, which means that 69.4% of the people are spending the money from their own pocket in 2004 to 2005. But when it comes to 2018 to 2019, so 48.1% of the amount towards healthcare expenditure is out of pocket, which is the persons people are paying by themselves. But still, according to the national health accounts, it is very high. So what happens is this runs a severe risk of pushing people into poverty. So around every year, 5 crore to 6 crore people are being pushed into poverty only because of the out of pocket health expenditure. IOOPE on health is impoverishing some 55 million Indians annually, with over 17% households incurring catastrophic levels of health expenditures every year. A World Health Organization report from March 2022 estimated. So, as I said, around 5 crore to 6 crore people are pushed into poverty just because of expenditure which they are paying out of their pocket towards health. So, which means I have saved around 20 lakh of rupees. But suddenly I'm having cancer, heart disease, which means that I have to give away my entire savings, my hard work towards my healthcare, and then I have to go for medicines, treatment every time. So this reduces my purchasing power, my in and salary, everything. So naturally, I'm getting below the poverty line, pushed into the poverty. Indian households spend rupees 2,87,573 crore on healthcare services, accounting for a major chunk of the total health expenditure. In comparison, the total country's current health expenditure is 5,40,246 crore, where the government has contributed to rupees 2,42,219 crore. This also includes capital expenditure. For example, per year, the cost going towards healthcare industry, medicines, treatment, everything is 5,40,246 crores. So, which is government is taking care of 2,42,219, like government hospitals, primary healthcare, free medicines, genetics, everything. So, but still, remaining things. So, around the 48 percentage, as we saw earlier, that is around 2,87,573 crore. Every individual is paying towards a healthcare. There are two people. For one people, the government's healthcare expenditure is enough to take care. But other people is not covered by any insurance, or there is no chance of government expenditure coming for him. So he is paying from his own pocket. So this is where the thing is. Like every household is spending nearly 2,87,570 crore in healthcare itself, which is very huge for a country of population size of 150 crore. Like there are many people doesn't cannot avail such a big service. While the proportion of OOPE on health has decreased over the years, it remains much higher than the global average of 18.1% as of 2019, according to the World Bank. That is, which is I am spending out of my pocket from my own money towards healthcare is very high in India compared to other countries. Globally, only 18.1% is out of pocket health expenditure, remaining are covered by insurance or government. But in India, it is 48.21%, which is mainly responsible for pushing people towards poverty, which means more insurance coverage should happen, government intervention, government spending on health should improve, percentage of spending towards on GDP towards health should improve. State-wise disparities persist. So let's see. In UP, 71.3% of healthcare is out of pocket. In Kerala, 68.6% is out of pocket expenditure. Jharkhand, 63.9%. Andhra Pradesh, 63.2%. Bihar, 53.5%. Madhya Pradesh, it is 55.7%. In Odisha, it is 53.2%. Punjab, it's 65.5%. And West Bengal, 68.7%. Which is, these are the states which have a greater OOP, out of pocket expenditure on health, than the national average. In Kerala, it's a unique case. Here, government spends a very good amount of the GDP towards health, but still out-of-pocket expenditure is very high. It's because more people are seeking higher cost of health. It's a function of higher health-seeking behavior of the residents of the Kerala people. Government spending on health in the southern state is the second highest in India. That is, Kerala spending towards health is the second highest, next only to Himachal Pradesh. So it's spending around 2,449 rupees per capita. In Himachal Pradesh, the government spending is 3,604 per capita. The larger figures for India, however, point to one reality. Health is not a priority for the government. So it clearly states that government is not focusing much on the healthcare. India risks a future of widening inequities, hindered progress towards universal health coverage, as well as increased morbidities and associated mortalities, as it is highly likely that the poor and vulnerable may forego treatment due to higher cost of care. Healthcare costs is increasing every year. In future, what will happen is poor people cannot afford the service, so they will say that it's better to die than to go for the treatment. We will be pushed to such a situation if the government intervention doesn't happen, if there is no focus on the healthcare. So people may fail to go for the treatment because of the cost. It will result in more mortality, or it will damage their life. They have to live with the disease, which will bring down the productivity of the country, economy of the country. India was among the 10 worst performing countries in terms of prioritizing health in government budgets at both state and central levels. So, both state government and central government are responsible for such a situation. According to the Economic Survey of India 2021, out of pocket expenditure spending on health services in India has important implications for poverty. How this out of pocket expenditure and poverty is linked, we will see that. The WHO report what states is existing literature for India shows that OOP payments not only impoverish a large number of households but also deepen poverty among already poor households. So it not only pushes people towards poverty, it also stresses the people in poverty line, below the poverty line even more. It even depresses them even further. It deepens their poverty situation. It worsens their situation even more. Many Indian households resort to distress selling of assets in times of hospitalization, which leads to increased incidence of poverty. Those at the margin occupying the lower quintile are most vulnerable. So people have houses, savings, land, some assets they will be having gold. But when the expenditure comes, they have to sell them. So which naturally pushes them towards the poverty. The people those are below the poverty line, that is occupying the lower margin, lower levels, are even more vulnerable. They can't even afford. In absolute figures, it means that 26 million people in 1993 to 1994 and about 55 million people in 2011 to 2012, according to WHO. So, but that is not all. Studies have shown poor people in India's poorest states are the most affected. A paper published in BMC Public Health in July 2019 found despite people living in states with high levels of poverty availing public health services more than their financially better off counterparts, they incur more cost. So, even though states with more poverty, people are getting towards public health services, but still they have to incur the cost of medicine in some way. Like poor people will naturally go towards government hospitals only. Despite using the government hospitals, despite going to the government institutions, still the poor people cannot afford the healthcare cost. They have to somehow depend on the private hospitals treatment, medicines, something. So this which means that it wasn't their economical situation. Mean OOPE per episode of hospitalization was lowest in Tamil Nadu, a fiscally stronger state, and highest in Bihar. So, a person getting admitted in Tamil Nadu. So, what is their out of pocket expenditure? It is very less. In Bihar, it is very high. For example, a person is getting into government hospitalization, private hospitalization for around 1 lakh people. It mean out of pocket expenditure is very less because of the government insurance, government expenditure, insurance coverage, everything. In Tamil Nadu, they have a very good system. Like state insurance is there, called Kalainer Kappidi Thittam, Mudalar Kappidi Thittam right now, which covers around 1 lakh rupees for the people. Exact number I'm not sure. I am from Tamil Nadu also, but I'm not sure about it. I'll get into it. Bihar is having very high OOP. Mean OOP is very high in Bihar. Low public health investment, poor public health infrastructures, non availability of medicines and diagnosis tests, and user fees are the main reasons for the high interstate variations of OOPE. Like in Tamil Nadu, government exceptionally does well in health investment. I am from that state. I very well know very good primary healthcare centers. Government hospitals give good treatment for cardiology, heart disease related things. So what is that? Why there is an interstate variation? Because of low public health investment, poor public health infrastructures. So there should be more hospitals, primary health centers for pregnant women, for children, everything. Non-availability of medicines, like generic medicines are not available, and diagnosis. He couldn't go for the right time, right diagnosis, right time, right medicine. This only can save the person. If we delay the time, if there is no availability of diagnosing a disease, then you end up in spending 3 to 4 times. So when a treatment is given at the right time, you spend a less. For example, 10,000. If it gets delayed, if you're diagnosing it later, 3 to 4 years later, the expenditure becomes very high, 4 lakh to 5 lakh. Because for heart disease, cancer disease, they get mature, they get more severe. Increasing public spending to 2.5 to 3% of the gross domestic product can significantly bring down OOPE to 30% of overall healthcare spend from 65%, economic survey report noted. For example, our out of pocket health expenditure is 65% right now. It can be brought down to 30% if India's GDP, 3% of the GDP is directed towards healthcare. Simple. A government is, for example, we are targeting a $3 trillion economy. If 3% of that is directed towards healthcare, then out of pocket health expenditure will reduce significantly. Thank you so much. We will look into another episode with more details.